Thank you, Maria. Wealth of information, and really appreciate your expertise in sharing. So for our attendees, please use the Q&A function to submit any questions, and we can start to answer them as we move forward. We do have our panelists here in order to highlight specific issues or questions that have been addressed. So I am going to get us started, and this is really for anyone, but one of the questions that we receive from our partners is, who is at most risk of losing their health coverage under Medicaid? Is it a specific population, or how can we, better understand who might be at most risk of losing their coverage?
Well, people who do not respond to their mailing are the people who are at risk of getting terminated from New Jersey Family Care. So this is not a special population or anything. I mean, if their income change, if they have different, eligibility now, that they might get disenrolled, but pretty much you have to send the mail back. You have to send the renewal application back so we can determine whether you're still eligible. So if you don't return it, then you're at risk of being disenrolled.
Thank you. And I think a related question that we've been hearing a lot, this was in the packet that was sent as well, is in that regard, if somebody misses their mail, or if someone is experiencing homelessness or living in unstable housing, are there special accommodations or guidance that you could provide in order for us to reach that population?
Well, they can use the address of the County Board of Social Services to get mail, or any other address where they can secure their mail. Could be a relative, could be a friend's address, to make sure that they receive that renewal packet. And if they need special accommodations, they can go to the County Board of Social Services and to the ADRC throughout the state.
Excellent. And then the way to update that information is the same as what you had shared previously. Is that correct?
Yes.
So an individual
calling the 1-800-701-0710 number.
And they can indicate that this is their address to receive their mail. Wonderful. Yes. Great. What is different or new about the eligibility requirements? Is there anything that's new?
Now, the eligibility requirements, nothing has changed. However, during the public health emergency, there were some flexibilities that we were allowing, such as like the self-attestation of an income or resources, especially in the very beginning when people couldn't get to their banks. But the eligibility requirements have not changed.
Thank you. And I see a question in the Q&A, actually two. Are you able to share the income levels for qualifying, or the income eligibility guidelines? Where can that be found?
They are posted on our website. It really depends. All of our programs, depending on if you're a pregnant woman, a disabled individual, if you're a parent with children. So the income guidelines do vary by program, but they are posted on the website.
njfamilycare.org.
njfamilycare.org. And I do believe, Nadia, that was the link that we shared with everyone previously in the chat. That's the main website. Great. We had a question that Dr. Glenn, I believe you already answered, but just for everyone who may have missed it, the question was, how many days do members have to respond to the New Jersey Family Care mailing? Or Dina, maybe you answered that.
Yes, they have 30 days.
Yes. And if somebody gets the termination notice, like they didn't respond in those 30 days, and they get a termination notice and realize, oh no, I never responded. There's an additional 90 days from that date of termination that they can submit that renewal information without requiring a new application. After the 90 days, after termination, a new application would be required.
Thank you. I did see that there's some link for income guidelines, so I've just placed that in the chat as well for our attendees. If a member is using the County Board of Social Services, should they call 711 to put that address on file? I think we might have touched on this already, but if you could just re-emphasize that.
Yes, if they can call their County Board of Social Services, but it's best that they call the 1-800-701-0710. They can do the address change there, and that's the number we're telling everybody to call. So it's not like they have to call two different places. They can call that one hotline and update their information.
Excellent. What resources are available for people who may lose their Medicaid coverage? What would the guidance be for that?
Well, we have the Get Covered New Jersey. So all other people that lose coverage is because they actually have coverage now through their employer or their own Medicare. But they can go to the marketplace, Get Covered NJ to purchase other options.
And Maria or anybody else, can you just speak a little bit to the marketplace itself? Because that is, my understanding is there's significant subsidies that can be available through the marketplace for folks to get low cost coverage. Could you just speak to that a little bit?
Their application is transfer. If they were terminated because of income, their application is automatically transferred, and they get evaluated at the marketplace, and they get the options of they can actually pick the plans that they feel is more affordable or best for them, and then they get the choices right away. So and the member can choose which one they wish to enroll. So they have 60 days. There's a special enrollment period for people who are disenrolled from family care. That is actually considered that special enrollment period. And they have 60 days to avoid gap in coverage to apply for coverage through the Get Covered NJ. There's a lot of information on their website. So this is not my expertise. So I'm going to ask people to just visit the website and try to get more information.
I do want to add also, just to piggyback on what Maria said, in some instances, a person's information will automatically be transferred to Get Covered if they've been terminated, but there's other instances where it will not. But the letter that they receive, their termination letter from the County Board of Social Services or from our New Jersey family care vendor, will indicate your information has been transferred, or we suggest reaching out, and there is contact information on that letter.
So again, really emphasizing that folks need to pay attention to their mail, read everything thoroughly, and follow the guidance as indicated in those letters.
Yes.
Great. So we have a question that came from our audience. How long after submitting the documents required does a person have to wait in order to hear back from New Jersey Family Care to see if they were approved or denied?
That could vary, especially because we're going to be expecting like such a large influx. However, everyone can be assured that you will not be terminated without proper notice. So it may take time to learn that you continue to be eligible. However, you will not be terminated. You will not lose benefits. We always give at least 10 days notice prior to a termination. So no one will lose their benefits without advance notice.
So I think this is a related question. It says, is a member's coverage still active while they're in the process of redetermination and or while they're in the middle of a fair hearing after they get terminated?
So if someone is terminated and requests a fair hearing, and there has been a change, there previously was 20 days given to request a fair hearing. Now we allow 60 days. So a person has 60 days from when they receive their termination notice to request that fair hearing. And every person who requests a fair hearing will be given a continuation of benefits. So their benefits will continue during that fair hearing process. That was a two-part question, and I forgot the other part of the question.
It was if a member's coverage is a member's coverage still active while they're in the process of redetermination?
Yes.
And or while they are in the middle of a fair hearing after they get terminated?
Yes. So they will continue to be eligible until they're determined ineligible, and they will always receive advance notice of that termination.
Excellent. So for low-income families that lose coverage due to housing instability, but they need care and are later able to recertify, will they be reimbursed for costs if it can be shown that they were eligible all along? Is there a retro? I think that's what this question is.
Retro eligibility can be given either by providing that information within the 90 days, or if they make an application after those 90 days, there's always, we can consider 3 months prior to their application date.
They would have to request it on the application,
Right.
correct?
Yes. On a new application, there's a question that says, do you have any unpaid bills during the previous 3 months? And they can indicate that they need to be considered for eligibility in those months.
Thank you. So we did have a lot of questions about special accommodations, which I think it may be helpful to have that conversation now. Are there any special accommodations or a special application process for individuals who have significant need and might not be able to independently complete this process? And I think even, that might mean updating their address. Is there someone that can call on their behalf to ensure the address is updated, or what does that process look like?
The member, if their address has changed, it's very important that they outreach and give that new address, because if we don't have your correct mailing address, you're not going to get the mail that we're sending. So if at any point you've moved, or even you just want to make sure, we recommend Maria's given the 1-800 number before calling and reaching out, especially if you are in a high risk group and you want to make sure you're not going to lose your benefits. Verify your address. Make sure you're responding timely to any mailings that you receive. Look out for those postcards, like we're giving people advance notice, heads up, you're going to be getting something in the mail. So just really keep an eye on your mail, especially if you are in a high risk group and you don't want to lose your coverage.
And then they get they get help from their care managers also at the health plans. I mean, they probably will not be able to act on their behalf unless they sign all the rights to the person, but the care managers are able to help members.
Correct. And also reaching out to our New Jersey Family Care, the 1-800 number, or to the County Board of Social Services. If someone needs assistance filling out that paperwork, their assistance can be provided for that. If somebody says, I received the mailing, and I'm in the process of gathering the documentation for you, but I need a little extra time, accommodations can be given, but there needs to be open communication. Let your county office know, I need more time, I'm working with you, and they should be accommodating to those reasonable types of requests.
And I think we answered this, but it's related a little bit, Dina. So how long do people have to complete the redetermination process before they could lose coverage? I heard 30 days, ideally.
Yes, 30 days. So that when they receive that information, it should have a 30-day due date on it.
Excellent. And how much time would individuals have to secure new coverage in the marketplace if they are determined to not be eligible for Medicaid?
I believe that it's a pretty quick process. When they receive that information, they'll work with you on the phone. They'll receive your application to select the plan that you're eligible for.
So again, it's important for us to continue the message to individuals that they need to be responsive to whatever direction they're getting in regard to their status so that they do not lose coverage. Would that be a fair statement?
Yes.
Excellent. From the audience, we had a question about for income eligibility. Is it an individual's personal savings / assets that are get taken into account? I'm not sure if our panelists would be able to answer that question or not.
Yeah, there are certain programs that take into consideration assets, and other programs only take into consideration income. So it really depends on the program that the person is eligible for. Our counties are trained to assess for all programs. So if you submit an application and they realize, oh, you're an aged person, this is the wrong program, they should be assessing and forwarding your application to the proper office to handle that eligibility. But it really depends. Certain ones consider assets and others don't.
Excellent. What should people do if they haven't received anything in the mail or if they're not sure if they did? Can we talk a little bit about that process, how this is working at the state? And I think maybe the 1/12 might be the part to start with.
Yes. Although we have 2.2 million members that need to be redetermined, we're only doing 1/12 of the members for the next 12 months. So in April, we did 1/12. Next month, we're going to do 1/12 all the way through March of 2024. April of 2024, I'm sorry. If members do not receive anything, they don't have to panic. They can call the 1-800-701-0710 number and make sure that we have the correct mailing address. So they don't have to think, oh, this is my month to renew, or unless they get a postcard from the plan, from the health plan, they know for sure that's their month they're going to receive the renewal packet. But they could get it in July, they could get it in October. It's not going to be right away. So don't feel nervous about not having any mail. But if you want to confirm that we do have the correct mailing address, please call the hotline and let us know what is your current address. Because New Jersey kept the same schedule, the same renewal process throughout the pandemic, but we did not disenroll anyone. It would be a good idea to think that if you were renewed last July, you're most likely going to get a renewal packet this July, with a few exceptions. Some people had to be moved from that schedule, but pretty much we kept the same renewal month for the people that kept up with the renewals during the past 3 years. So that message again, 1-800-701-0710.
I know we've had this question as well. Can somebody renew early? So say an individual is anxious, they're worried, they just want to get it over with. Can they do that?
No. Because it's 2.2 million members, we had to spread it evenly. So we don't want to miss that spread, that timeline. Just wait until it's your time.
So it goes back again that the message is update your address, make sure that's correct. You'll expect to get a postcard at the start of the month, a renewal packet, and a text or an email at the end.
Yes.
Great. Big question, and I don't think we're there yet when we just started, but I know we want to prepare. The appeal process when folks are told that they're no longer eligible. Can we just revisit what that process is for folks on the line and how partners may be able to assist individuals?
When a termination letter is received, there is a fair hearing rights page with all the instructions that are needed. There's information to fill out with your name, address, phone number. I think we've even added now an option to enter your email address, and an explanation as to why you disagree with the determination that was made. Previously, you had 20 days to make this request. Now you have 60 days to make this request. So if you receive the termination date, you can submit that request because you disagree with the determination that was made. And every person who makes a request for a fair hearing will be given a continuation of benefits. So your benefits will be reinstated until the outcome of that fair hearing.
Excellent. Okay, thank you. I think that was very helpful. There was a question, we're all, I think, want to make sure that we're able to support the state and really support the individuals that all of these partners work with on a day-to-day basis and really get prepared. And I think it's important that in that excitement and that energy that all of our partners also realize it's important to stay with what the talking points are so that we can stay consistently and that we don't add confusion to the process. And the 1/12th, I know, is something that, you just articulated today as well. And we had a question from the audience that said, when will the Passaic County recertification letters arrive? So I'd like to go back to the state process about the division into 12ths, and maybe you can explain that a little bit for our audience, Val.
Correct. So Passaics won't go out all at once. We took Passaic's universe of every case that Passaic supervises and divided that by 12. Same with every other county. Every county's been divided by 12.
So 1/12 of the folks in Passaic County received recertification letters in April.
Correct.
And another 1/12 will receive them, the postcard, the letter in May, et cetera, et cetera.
Mm-hmm.
Correct. Who is reviewing applications? I think this question actually goes to, it says, is it the county boards or New Jersey Family Care? Maybe we can talk a little bit about how that can work. How can folks use the services at the County Board of Social Services?
Well, it's both, right? So our New Jersey Family Care office does determine eligibility and renews eligibility for a portion of that 2.2 million, but so do the county offices. It's going to be whoever supervises your case that will process that renewal. However, all of these offices are available for assistance. So if someone needs assistance filling out their paperwork, they might show up at their Passaic County Board of Social Services, even if their case is being supervised by our New Jersey Family Care office. Either office can offer the assistance, but it will be whoever currently holds the supervision of that case that would actually do the processing of that application.
Excellent. Is an email address required to complete this process?
It is not. However, one thing that's fairly new is our county offices do have the ability to offer some members online renewals. So for our family care members who receive renewal, they might not, let me start back. They might not get a renewal application. What they might get in the mail is a code along with their application that says, if you want to go online, here's the link. That's not available to our aged and disabled population yet, but for our other family care members, some of them might just get an application in the mail, but some may get a renewal code. And if they choose to apply, do their renewal online, they can do so. And
then they would need an email address, obviously.
Correct, to do that online. Or they would have to, actually, I don't want to say that because they're getting a code and a link to our website.
Okay.
So they would enter, it would be like a R with some numbers after it, and they would go to the link on the website and fill it out online.
Excellent.
Not so it's not emailing it in, it's submitting it online to our portal.
Okay, great. And that I think goes back again to the message of really pay attention to what's in those mailings because it may look different for different people. That's accurate to state?
Correct. And if somebody's not comfortable, some people want to do it online. If you're not comfortable with it online, that you'll get that renewal code, but in that same packet is also an application, so you can submit it on paper.
Excellent. Thank you. In regard to the renewal packets, are they sent in in any languages other than English? How does that work? We do have a large population up in our region here that have diversified languages. So is it only English?
English and Spanish. But if they need help with translation, they can call the hotline 1-800-701-0710. And they have help with translation to many other languages. But right now, we currently have the application only in English and Spanish.
And I think, Maria, you definitely have that that number memorized. So I appreciate the repetition is good for all of us, because I think that's the best way that we can help our folks in the community to really reach out on that number, get their address updated, utilize the address of the Board of Social Services if necessary, and work within that office there to help make sure that we retain coverage.
And help with translation as well.
Yes, yes. Okay. I think the other question that we had that just popped up, and I know we're almost at time, but was again about how much time individuals have to secure coverage in the New Jersey health marketplace. What I've heard in the conversation is that it's a relatively quick process. Is there a specific deadline? I mean, do people have 60 days to go get coverage in the marketplace, or how is there a window?
For what I understand, they have 60 days to get coverage to avoid a gap in coverage, but they can apply it at any time after that. They're just, gonna have that gap. But they're pretty fast with their determinations, though.
Right. What type of documentation will individuals need in order to complete the redetermination process? So they'll get an application in the mail. Are there certain documents that need to be submitted with that application? Can we talk a little bit about those requirements?
The county offices and our New Jersey Family Care Office can electronically verify a lot of information. There are instances where they may need to request that the person submit documentation. For example, we can't verify the income of somebody who's self-employed. So that type of documentation would need to be submitted. As far as assets, if it's somebody for our age blind disabled programs and we need to verify assets, we do have an asset verification system, but there may be certain banks, especially like your smaller, like not your large regional banks, that might not participate in that. So again, they may need to request that bank statements be submitted in. But anything that's required and not received. So if an application submitted and the county realizes, oh, we need information about this, they'll send out a request for that information, and 14 days is given to submit any additional information that's needed to process. But the county will make all attempts to verify electronically first before asking for paper documentation.
Excellent. So I think, when we first heard this concept, there was thoughts about holding like redetermination or reapplication like sessions with community partners, right, where individuals could come and go through the process. Obviously, that's not the case with the 112th and how we're moving forward, but what kinds of sessions could community organizations or partners host? Are there information sessions? Are there other ways that we can support this initiative, checklists, other things?
Well, we're working on training materials. So any community organization that wants to help members fill out their renewal can sign up for the training. And we also are working on finalizing a checklist with the paperwork that is needed to apply. We're going to share the slides that were presented today, and then there's that email address to sign up for the training to be able to provide assistance. We're not doing the clinics like come everybody and renew, because we're sticking to the schedule of the 112. But any community organization that wants to be able to help can sign up for the training.
Great. And I'm hoping that all of that will be part of the packet that we can send to our partners with the links defined as to this is where you can get training, this is where you can get additional information or other resources. Is that a yes?
Mm-hmm.
And also check out the website. Like there's a number of websites in the chat. So, being able to share any of the websites, go there. There's a ton of information there.
Yeah, I know for me, sometimes the chat gets a little unwieldy, so we'll work to get everything concise and in a nice format for all of our partners and the folks who are able to attend here today. Dr. Glenn, did you have something that you wanted to add?
Yeah, I just was going to say in terms of like community partners, just making sure people are aware. We're in this day in, day out, and this is kind of our world. But we also understand that our individuals and families have many priorities that they are conquering every day. So we understand that there may be a lack of awareness. So any awareness that our community partners could bring will be great. What you brought up, someone asked about the renewals in different languages, any language barriers that people are experiencing and throughout different communities, if they can provide the our 1-800 number so people can call, that will be helpful. The administrative burdens or hurdles, we don't have real-time data at the state. So if someone moves June 1st, like, and a community member knows, hey, I heard you say that you were moving, don't forget to do this, because our real time is definitely different than what people are experiencing. We know that the unemployment rate is at record low, right? So people may not qualify for Medicaid, and just making sure that people transition, or they may need help with transitioning to their employer health coverage. That's hard. Like, this is not like, okay, just write a post on Facebook. Some of this stuff is really like, what are you asking me? How do I do this? So making sure people understand what employer sponsored insurance is and what get covered is and what Medicaid is. I think these conversations are really, important for people to understand. What does it mean, a subsidy? I got a job, but now you actually want me to pay for insurance. How do I afford that too? So these are, I think, real issues that on a community level can really debunk what's happening and also educate people on what their rights are too.
Thank you so much. I know we have amazing partners here up in Passaic County who are so dedicated to this work and assisting folks in need. And so we look forward to these continued dialogues and just resources that we can bring to individuals, and also elevating the issues that we're hearing to all of you to brainstorm and think through the best approach and nuances. It's going to be a huge undertaking over the course of the next at least 12 months. And so we've been through a lot together. I think we'll be well positioned to get through this as well. And I know New Jersey is really dedicated to ensuring that folks do not lose coverage. So very grateful to have excellent leaders to make sure that we can do right by everyone. I'm sure it's not going to be easy. There'll be some bumps in the road, but we'll get through it together. So I would like to thank all of our panelists and thank all of you who were able to attend today. This is the second in a series of roundtable discussions that HCPC is going to continue to host on a variety of public health issues. At the close of today's session, you are going to receive a link to a survey. We ask that you please take a moment to complete that survey so that we can gather your feedback and also address concerns. Please be honest, it is anonymous. Have a tough skin here in New Jersey, so we'd like to hear what we can do better, and really appreciate your time and want to make sure that we're making use of that. In the coming days, we'll be following up with a recording of today's session and additional resources, and also a link to sign up for any HCPC news of upcoming events and way for you to also elevate some of the things going on in your organizations. Our mission is to connect community partners across all sectors so that we can together drive health equity, which is a big part of why we launched this roundtable series. So we look forward to seeing all of you again at the next roundtable. May actually have a similar topic as we continue to evolve in this rollout. We may pull all of you here again, if that's okay. Maria and Dina and Nadia, really thank you so much for your time and expertise today. Anything any of the panelists would like to say before we close?
No, thank you for the opportunity to share this information.
Thank you all.